Hello, my name is Dr. Anthony Pilato, board-certified prosthodontist here at MAID. If you listen closely, you can hear the hum of these machines next to me. These are 3D printers. About 2 years ago, we started adding 3D printing to our workflows here at MAID. One at a time, each printer served a different purpose. 3D printing changed the way that we're able to interact with our patients because we were able to make treatment immediately more personalized, even with the addition of the first printer. So initially, the first printer was doing a little bit of everything. It was printing models, it was making surgical guides, it was making try-in smiles. It was kind of a workhorse in that regard. But quickly we realized that it was running all day long, and we were having to switch between different types of prints. You see, each time we switched between a model to a surgical guide to a try-in smile, we had to change the liquid resin that goes in it. So we quickly realized that if we're printing all day long, it's best to have a dedicated printer for each purpose. So I'm going to explain what each printer does, and that'll give a little bit of context to how it's been helpful for us as a practice. This first printer now just prints models. So no longer do we pour up with stone and powder in the laboratory and make a model that if a tooth chips, we have to take a new impression on the patient or call them back in. Nowadays, what we do is we scan the patient in the mouth, real simple procedure. And then we have a computer file that we could send to the printer, and we could have that file forever. So if we need to send it to another dentist, we could send the file. If we need to print the model for another dentist, we can print the model, send it to the dentist. It just gives a lot of flexibility, and it's extremely accurate. So this printer all day prints models. This next printer only prints surgical guides. So here at MAID, we do a lot of surgery to place the dental implants and also restore the dental implants. Now, there's nothing worse than having an implant in a position here and then having the tooth need to be here. It's like building a foundation of a house in the wrong place. What we do is we actually scan the patient again, and then on the computer, we're able to design where the implant needs to go. Then we actually design a surgical guide. That guide has to come to life somehow, right? It's no good for us if it's just on the computer. So we can print those guides using this second printer. And these models and these guides, the really cool thing is we can spend the time to take the records, design it on the computer, but it only actually takes a few minutes to print and physically hold in our hands that model or that guide. So that second printer has been very helpful in terms of making sure we have accurate surgeries done. The third printer in the back there, this one is our workhorse for making smiles. So just like we can scan the patient and then print a model or print a surgical guide, we can also design a trial smile. So this has been extremely helpful in making sure our smiles are custom and comfortable for patients. It doesn't print a final set of teeth. So these are not teeth coming out of the printer that are gonna last for 5, 10, 20 years. But these are teeth that come out of that printer, whether it's veneers or bridges or dentures or implants. These are teeth that the patient can wear in their mouth, oftentimes even if they have surgery the same day of surgery. And they can wear those home for weeks and months at a time to make sure that they feel good, that they look good, that their friends, that their spouse, that their children approve of, right? Oftentimes, a patient will say, yeah, I like them, and then I went home and my wife said, oh, those need to be changed a little bit, or my daughter mentioned this, or my son mentioned that. The cool thing is we can incorporate those changes into our design, just reprint another tooth or teeth, and then you or the patient can wear those teeth for another week, 2 weeks, and actually do a test drive. We say a walking test drive of that smile. So that's what's happening on that third printer. It's printing teeth all day long. And those teeth go into the patient's mouths and they can wear them to evaluate them. Then, once we know that we love that smile, then with a different technology, we can actually make the permanent set of teeth. So that's printing in a nutshell here at MAID. 3 printers for us has been a great mix. I don't see us needing more than 3 at this point, but less than 3 would be a challenge because these printers really do serve us a great purpose. Thank you. I hope that helps to understand 3D printing a little bit, and we'd love to see you. Thank you.